Hi, good afternoon. This is Harpreet, and today we're gonna discuss our journal time. It's so exciting. We are done for the whole class and for our whole course. So I'm so excited. So right now I'm working as a family nurse practitioner, and now when I saw the patients in my facility, like patients are suffering a lot for like psych. So then I decided to go to the taking the postmasters in psych. So okay, we go for our questions. So our first question is, what goals did you set for yourself at the beginning of the semester? Did you meet this? Yes. So this is our last semester, so definitely I set some goals, for example, to see outpatient and inpatient psych patients. So I met that goal, and secondly, in this semester, I know that this is our last semester, so I set goal for myself to get knowledge as much as we can. So in practice, I don't feel like alone or something like I don't know this thing, that thing. So this semester was like really good experience. So I saw some tally patients, so at least I get experience how I can do some tele encounter and substance abuse patients. And then I realized that like patients really needs um, to psych providers to provide them and to help them for medications, because sometimes they are looking for the providers, but unfortunately they didn't get the help, and they want to quit the smoking, alcohol, opioids, but sometimes they don't get the provider and they are continue their same thing. So with this semester, I was happy, like I get a provider who was working in a substance abuse, and I get really good experience. She's really nice. And second question, what feeling, prejudice and biases did you experience during your clinical experience, and how did you manage them? So regarding like our medical field, so I mean, it's 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 too much, or I mean, so basically, so regarding patient with psych, so um, psych patients is, they are manipulating and all that things happen. So during starting I was little scared when I saw patients, when I get experience, then I realized this is normal. Sometimes it's not their fault, because they are not stably, they are mentally not stable, and they don't know what they are doing. So that what I learned, because as a family nurse practitioner, we believe whatever the patient tell us, we just go according to that. But this one, we need to focus their more mental health. We have to find everything, find the history and everything. So regarding anxiety, self-doubt, how I manage, so definitely as working as a family nurse practitioner, it helps me. So because I working in the psych, so that experience helped me to reduce my anxiety and self-doubt, or and my preceptors are good, my co-workers were good. So I always ask for help. I if I don't know, means I don't know, I can ask my preceptor, my senior, my doctor, so my collaborative physician. So I need to treat the patient, so I don't want to compromise anything for that thing. So definitely I ask for help, and definitely I reduce my anxiety when I see every day the same patients, or every day see the patients with the different experience, so it helps me. So what understanding or insight did you develop during your clinical experience? So this time, um, regarding substance use or alcohol use disorder, so I learned a lot. Sometimes we need to guide the patient, we need to motivate the patients, so they can quit. So initially they don't agree, later on when they think, they start understanding their problems, and then they start to want to quit these things. So that is really good experience. So when we help the patients and they feel like now they quit their opioids or smoking or alcohol, it make you happy. So I really like that experience. Has a reflective practice impacted you as a person, student, or provider? If so, and how? So yes, so regarding this thing, I want to learn. Has reflective practice impacted you as a person, student, or provider? Yeah, it affected me as a student. So I mean, it depends on the area where I'm going. So when I get my experience as a student in different areas, I saw the difference. So we have to know the demographic things too, where we are practicing, and how's the community, and how's the patient, and how's we can help. So these things matter. Secondly, um, yes, so definitely as a student it impacted me. Will you continue use reflection in your future practice? Yes. um, the thing is like, medicine world is very vast and very wide. So my thing is to learn, to continuously learning, and researching, and up to date, get the up to date articles, what treatment is going, and what new research is coming, and what it if impacted. So there are many things. So my thing is like, to help people as much as we can. And now some patients are like, oh, we can't be compliant with the medication because we don't remember the medications, to take the medication every day, or we don't like to take the medication every day. So now there are many researches showing weekly injections, so we can help patient with these things, so they can, if they don't want to get the medicine, at least they can get the injections weekly, and so they can help themselves. So I think this is the thing we can help. And I want to say thank you to my professor. She You are amazing, you help us a lot. So you are cooperate with us, and you give us motivation and clear our doubts. So it is only possible for because of you, and our preceptors, or our all the family. So thank you so much. I'm so excited to work as a psych provider, and help my patients as much as I can. And because they patients looking still for providers. Sometimes patient came to the hospital for refill of the medications. This like, we don't get an appointments if we didn't get medication. They feel like same depressed, anxious, or suicidal ideation. So they come back and forth only because they don't have we don't have that much psych providers. So my I'll try my best to help as much as I can. And I want to say thank you to everyone who support us, who support me during my journey. Thank you so much.